Hello, I'm Scott Frakes, Director of NDCS. Here with me today is Dr. Harbans Deol, our Medical Director. Before I give Dr. Deol an opportunity to speak, I'd like to just address a few things. So we're working hard to ensure that our strategies and our approaches keep everyone safe. One of the things we've done is really simple, but it's highly effective, and that's we've given out free bars of soap to everyone. And we have more soap in the warehouse, so if your bar of soap runs out, please ask for another one. The issue there is wash your hands. Wash your hands and wash your hands some more. That's a really important part of stopping the spread of the virus. Connected to that is keeping areas clean. So keep your cell clean, keep the areas that you're responsible for clean. And then we have our porters who are doing an excellent job of taking care of sanitation across all of our common areas, using the right sanitizing tools and the right approaches. We provided incentive pay, and people are delivering. That's really important. The cleaner we keep things, the more challenging or the more difficult it is for the virus to spread. Toilet paper's been a concern, a much bigger concern in the community. We have a good supply. We just received another shipment into our warehouse. We have another shipment coming. So we don't have a shortage of toilet paper, but we need to be smart right now. We need to make sure that we don't waste toilet paper. So staff will be asking you to bring up an empty cardboard roll to get another roll of toilet paper. That's just part of how we're going to control the flow, keep track, and make sure we have enough for everyone. So you're aware at this point, I'm sure, that we had to stop visiting most volunteer activities. We are screening everyone that comes into our correctional facilities. And if they are showing symptoms or just simply are saying they're not feeling well or potentially have been exposed to someone else, then we're asking them to stay home until they're able to either get tested or determine that they're actually not feeling ill. We can't stop this virus from coming into our prisons any more than we could stop it coming into our communities. The strategy, the goal has been to flatten out the infection rate. And I want to let Dr. Deol talk more about what that really means. But that's a strategy that is working, and it is working extremely well in Nebraska. And it's worked very well for us because as I stand here, there is no one in our system at this point that we're aware of that has coronavirus, COVID-19. So reducing, eliminating visits and eliminating most of the volunteer activities, greatly reducing the amount of programming activities and other impacts that we have because of our social distancing approach creates a lot of idle time, and I recognize that. So some things that we're doing to help both fill idle time, give you things to do, and to allow you to remain connected with your family and friends. We've activated the video games on the JPay system, and those are now available for everyone that has a JPay tablet. And the JPay tablets can be purchased if you don't own one at this time. We have activated the system that will allow your family and friends to send videograms on the JPay system as well. There's a memo coming out that explains more about that. GTL, our telephone provider, and the GTL tablets that almost all of you have at this time, they have said that they will provide 2 free 5-minute calls per week. There are some rules around that. That'll also be explained. I believe information has come out about that, but we'll make sure that everybody understands what the rules are. And then we also expanded access to the phones from 1 hour to 2 hours a day for those that have a tablet. So we're looking for ways to make sure that we keep people engaged, we keep people busy, we provide you ways to stay connected with your family and friends, and that we do everything we can to work together to get through this pandemic. And now I'm going to bring up Dr. Deol. Nebraska and NDCS is so fortunate to have someone of Dr. Deol's skills, background, knowledge, caliber leading our medical efforts. Dr. Deol's a national expert in these issues, and I'm going to allow him to come up here and talk to you about both his background as well as how we're managing the COVID-19 coronavirus pandemic. Dr. Deol?
And I am Medical Director Dr. Harbans Deol for the Department of Corrections. I'm here to discuss with you today the spread of COVID-19. As you may have heard from the TV or media, that COVID-19 is an epidemic in the United States. Also, it's a pandemic in the U.S. But I want to talk about the precautions that we take to limit the transmission of COVID-19. As you heard from the director mentioning about washing hands, that is the prime consideration of washing and limiting the spread of the virus. We also want to make sure COVID-19 is unique in the sense that it is nobody's immune from COVID-19 virus. So everyone gets it. The question comes up, who is much more susceptible to the virus? And we need to think about our older population with chronic conditions. They tend to be susceptible, and the serious illnesses do occur with people with immunocompromised conditions. The younger folks do get the virus as well, but they have mild symptoms. But the things that I want to talk about are the cardinal symptoms that we will distinguish between COVID-19 and the influenza is that people get high fevers and cough and shortness of breath. There are associated symptoms with COVID-19, and we have seen some patients actually exhibit some nausea and diarrhea compared to the influenza virus. The other mechanism that I do like to discuss with you is the influenza virus spreads by aerosol. COVID-19 is a droplet process. So if you have a social distancing, you're not subject to those, and also using some of the cough etiquettes will help. And washing the tabletops, and do not touch your eyes, nose, and mouth so you do not spread that infection to somebody else. We have the order test kits, and they will be arriving, and we'll be testing people based on the clinical conditions. So if there is a need, we will test for folks as well. I do want to assure you that if you do occur some of those symptoms that we talked about, you really need to seek medical attention like you've done in the past. We have done a great job as for curtailing the influenza virus since December, and we will continue to manage COVID-19 the same way. But I also want you to take your part in helping us to limit the transmission of the virus. I am chair of the Healthcare Committee for American Correctional Association, so I chair all health authorities of 50 states. And we had 2 webinars recently that I chaired and moderated and gave a talk about it. So the message that we're giving you today, we give the messages nationally as well. So the same message is being conducted throughout nationally. So we are taking the same precautions in Nebraska as well. But I want to assure you that if you do exhibit those type of symptoms, make sure you still do seek medical attention, and we'll try to address all this individual patients. I do want to also make sure that there might be a possibility that we might have to isolate some folks, but that's also to protect you and protect the staff and the healthcare staff as well. And we'll continue to update this spread of virus if it occurs within corrections on a weekly basis or every other week. And please, as a last resort, just mention the director, hand washing is very important, and social distancing is going to be important, and also take care of yourself and take care of everybody else around you.
Thank you, Dr. Deol. So again, as I stand here right now, there are no known cases of COVID-19 coronavirus within our prison system, either among the inmate population or among staff. But as you also know, this is a rapidly changing situation. I am very pleased with how people are treating each other during this pandemic. A big part of how we're going to get through this is by treating each other with respect and taking care of each other. And I'm seeing that happen across our system. And I thank you for that. There's no question. You're under stress. You're under tension. Your families are stressed. They're under tension. The staff are stressed and under tension. I'm a little stressed and under a little tension. But collectively, taking care of each other, treating each other with respect, treating each other with the care that we absolutely can show each other, we'll get through this. This isn't a staff thing. It's not an inmate thing. This is a worldwide situation. And there are people working around the world to help address and ultimately stop this pandemic. So I thank you. Remember, wash your hands, 20 seconds at the very least. Wash, rub all the way around, rinse. Keep your hands clean, keep your areas clean, take care of each other. As I have new information, I will provide updates. If there's something special or some new significant information, I'll do additional updates. I thank you for your time. Take care.